You know how some things are right in front of you your whole life, and you never knew they meant anything. Today might be one of those moments. Before we say another word, we need you to do something. Reach up and touch your earlobe right now, the soft, fleshy part at the bottom of your ear. Now feel along it gently with your finger. Is there a small line there? A crease? A diagonal fold running across the earlobe? Take a moment. Check both ears, because what we are about to tell you has been known by doctors for over 50 years, and most seniors sitting at home right now, touching their earlobe for the first time, have never been told any of it. Stay with us. This one is important. Let us start with a story. Back in 1973, an American doctor was seeing patients with heart problems, and he kept noticing something. Many of his patients, the ones with serious heart disease, had a small diagonal crease across their earlobe. Not a sleep crease, not a random wrinkle, a specific line, running diagonally across the soft part of the earlobe at an angle. He published his findings. Other doctors looked. And over the next 50 years, study after study came back with similar results. There appeared to be a real connection between this small crease and heart health. Now, we are going to be very honest with you about what this means and what it does not mean. Because we do not want to frighten you, we want to inform you. Here is the simple, honest truth about this crease. It is not a diagnosis. Finding this crease does not mean you have heart disease. It does not mean anything is definitely wrong, but it is a signal. A visible sign that the body may be showing, something worth paying attention to, something worth a conversation with your doctor. Think of it this way. Your body is always communicating, sometimes loudly, with pain or fever or breathlessness, and sometimes quietly, with small visible changes that most people never know to look for. This crease is one of the quiet ones, and the reason it matters is this. Heart problems in seniors often build very slowly, very quietly, with no pain, no obvious warning. For years sometimes, the earlobe crease does not hurt. It does not cause any symptoms. It is just there, in the mirror, every single day. And if it is a signal, you deserve to know that, so you can act on it. Let us tell you what the crease looks like so you can check properly. Look in a mirror in good light. Look at the bottom of your ear, the soft part that hangs below the cartilage. That is the earlobe. Now look for a diagonal line, not a horizontal wrinkle, not a fold from sleeping, but a line that runs at an angle, roughly from where the ear meets the face, diagonally across to the outer lower edge of the earlobe. It may be subtle, or it may be quite clear and defined. Check your left ear, then your right. Some people have it on one side, some on both sides. If you are not sure, ask someone you live with to look. Sometimes another pair of eyes makes it clearer. Take your time. There is no rush. Now let us explain why this might connect to the heart. In simple words, your body has blood vessels everywhere. Big ones, small ones, tiny ones. The earlobe has very tiny blood vessels running through it, and the heart also depends on its own blood vessels to work properly. Over time, with age, with certain lifestyle factors, with genetics, these blood vessels throughout the body can slowly change. They can become slightly narrower, slightly less flexible, slightly more affected by a process called hardening of the arteries. When this happens to the tiny vessels in the earlobe, the tissue those vessels were nourishing slowly changes, and that change shows up as a crease. The earlobe is not causing any heart problem. The crease is not causing any heart problem. But both the crease and any underlying heart changes may be coming from the same slow process happening in the body's blood vessels over many years. It is like two different warning lights coming on in a car. They are not causing each other, but they may be coming from the same underlying issue. That is why the crease is worth knowing about. Here's what we want you to do if you find this crease. First, take a breath. This is information, not a verdict. Second, look at both ears, one side or both sides. Write it down if you like. Third, book an appointment with your doctor, not urgently, not as an emergency, just in the next week or two. And when you get there, say something like this. I saw something about earlobe creases being connected to heart health. I have one on my earlobe and I just wanted to mention it. Can we make sure my heart health has been properly checked? That is all. Simple as that. Your doctor will know what this means. They may want to check your blood pressure, your cholesterol, maybe do a simple heart tracing called an ECG. None of these are scary tests. They are quick, they are painless, and they tell your doctor a lot. You might go and find out everything is perfectly fine, and that is a wonderful outcome. Or you might find something that needs a little attention, and catching that early, before any symptoms develop, is exactly when it is easiest to help. Either way, you leave the appointment knowing more than you did before. Let us tell you about two other things worth checking while you are looking in the mirror. The first one is a pale gray or white ring around the outer edge of the colored part of your eye. It might look like a thin arc, or a full circle, around the iris, the colored ring around your pupil. In people under 60, this can sometimes be associated with high cholesterol. In older adults, it is more common and often means less on its own. But it is worth mentioning to your doctor alongside the earlobe crease if you notice it. The second thing is small yellowish patches near the corners of your eyes, sometimes on the upper eyelid, sometimes below, small, flat, slightly yellow in color. These are harmless in themselves. They do not hurt, but they can sometimes indicate that cholesterol levels deserve a closer look. None of these things on their own mean anything is wrong, but all three together, the earlobe crease, the eye ring, the yellow patches, paint a picture that is worth a conversation, not a panic, just a conversation. We want to say something to you directly before we finish. You may have had this crease for years, decades even. It has not changed anything today. Nothing is different today except that you know something you did not know this morning. And knowledge, when it leads to a simple doctor's appointment, can be one of the most powerful things in the world. So many serious heart conditions are caught not because someone felt something dramatic, but because someone noticed something small, something quiet, something that was right there all along. This crease has been on your earlobe this whole time, just waiting for someone to explain it to you. Now someone has. Book the appointment. Mention what you found. Let your doctor do the rest. That is all we are asking. Let us go over what we covered today. There is a diagonal crease that can appear on the earlobe. It has been studied for over 50 years. Research has shown a connection between this crease and heart health in some people. It is not a diagnosis. It is a signal worth checking. How to look for it. A diagonal line across the soft lower part of the ear, on one side or both. What to do. Book a routine appointment with your doctor and mention what you found. Use the simple words we gave you. And two other things to look for in the mirror. A gray ring around the iris of the eye, and small yellowish patches near the eyelids. Share this video with someone you care about. Ask them to check their earlobe. It takes 5 seconds, and you genuinely do not know what that 5 seconds might lead to. Subscribe for a new simple health video every week, made just for you. Take care of yourselves. Look after each other. We will see you next time.